Hello, my name is Dr. Jeff Harris. I'm a psychologist in New Mexico in the southwestern part of the United States. This is Key Strategies Training Lesson 3, where we're going to be talking about changing thoughts using cognitive strategies. So in Lesson 2, we talked about exploring thoughts, and now the next phase of treatment is to change thoughts. And these slides and these descriptions of skills were developed by Aaron Hammond, a colleague of mine about 10 years ago in 2011. So let's proceed. So all of the cognitive therapy was developed by Aaron Beck and starting in the 1970s. And the best overview book about cognitive behavior therapy is by Judith Beck, who was Aaron Beck's daughter. So the quotes that we're going to be using in this lesson are from Judith Beck's book, Cognitive Behavior Therapy, Basics and Beyond. It's in the third edition, was released in 2020. Some of the quotes we're using are from earlier editions. So here's an overview of kind of the idea of changing thoughts. We talked about exploring last week. We're talking about cognitive change this week. What is of particular significance to the cognitive therapist is that beliefs that are dysfunctional can be unlearned, and new beliefs that are more reality-based and functional can be developed and learned through therapy. So in the same way that people learn dysfunctional thoughts, they also can learn more functional ways of thinking. So in this cognitive change portion, we're going to be talking about 4 strategies: experimenting with thoughts, modifying beliefs, reinforcing functional thoughts, and assessing cognitive change and impact. And I want to highlight that these, particularly cognitive strategy 5, 6, and 7, are not just going to happen once and you're done. It's going to be an ongoing process. So this is going to take a little bit more time than the exploration phase for many people. Sometimes people can embrace cognitive change pretty quickly, but 5, 6, and 7 that may be the focus of psychotherapy for several sessions. So the first change strategy is experimenting with thoughts. And so the idea here is that we're going to be experimenting with thoughts to evaluate their accuracy and test alternatives. So the theoretical context is Judith Beck suggested that automatic thoughts can be evaluated according to their validity and their utility. The most common type of automatic thought is distorted in some way and occurs despite evidence to the contrary. So let's zero in on those two words, validity and utility. Validity is whether something is true or not. And utility is whether it's useful or not. So my example is often that if you say my boss hates me, that might be true. That's the validity, but thinking my boss hates me, my boss hates me, my boss hates me may not be a useful or functional way to think, because that may make you more depressed or more anxious. So a more useful thought might be, this job is not a good fit for me. So I want you to think about those two ideas, validity and utility. Is it true and is it useful? What's the function of the thought? So the marker for this strategy is when it becomes clear that a client holds a strongly believed dysfunctional idea, the therapist can assist the client in gaining a more balanced perspective by exploring evidence for and against the idea and or designing an experiment to test the idea in the outside world. So because we're experimenting with thoughts, our little white figure in the graphic is a experimental with a test tube and a flask. So we're taking on an experimental role here. So cognitive therapy talks about collaborative empiricism, where the counselor and client collaborate to empirically test the the thoughts and to try and change them and try and see if new thoughts have a different impact. So it's an experimental approach. So here are some suggestions for experimenting with thoughts. So you can take a structured approach with your clients, asking them for alternative explanations of their beliefs, what the best, worst, and most realistic outcomes of a situation could be, the effect of believing versus changing their thinking, and what the client might say to a friend in the same situation. So these are all strategies that have been developed in cognitive therapy and are summarized in the Judith Beck book if you want a little bit more detail. But there's lots. So the point of this slide is there's lots of ways to help people experiment with their thoughts. So the expected consequence of this strategy is that the process of evaluating confirming and disconfirming evidence, whether through questioning or experiments, teaches clients to reason inductively and use their own intellectual resources for problem solving. So we're going to be looking, it's often in cognitive therapy, there's often when you identify a specific thought, you're looking at the evidence that supports or confirms that belief and evidence that disputes or disconfirms that. So we're looking on evidence at both sides and then trying to come to a more logical, more rational, more evidence-based conclusion. So here's an example. So this is the same example that we used in lesson 2 with someone who's depressed and isolated and socially anxious. So the counselor said, so this thought that people won't like me is based on very real discrimination experiences. This thought is strengthened when you find yourself alone because you think it confirms that no one wants to be with you. Are there any other possible explanations for why you're alone all the time? And the client says, well, I guess it could be because I usually just don't even try to go out because I'm too afraid. So this example of experimenting with thoughts is the counselor trying to help the client look at different explanations. So although the client may have had experience where some people didn't like them, the client's experience of remaining isolated and not making social contact confirms that dysfunctional thought. So that's cognitive strategy 5, experimenting with thoughts. Let's go on to the next strategy. So cognitive strategy 6 is modifying beliefs and identifying more functional thought. So the context here is what is of particular significance to the cognitive therapist is that beliefs that are dysfunctional can be unlearned, and new beliefs that are more reality-based and functional can be developed and learned through therapy. So after there's been some experimentation using strategy 5, now we're going to identify specific, more functional thoughts. So again, it's not like you're going to use cognitive strategy 5 for 10 or 20 minutes and then you're done. It's going to be an ongoing process, and so is modifying the beliefs. So again, these are not just one and done. Particularly cognitive strategy 5, 6, and 7 are going to be an ongoing process that may be the focus for a number of sessions. So the marker for using this strategy is that once clients have worked to identify dysfunctional thoughts and evaluate their accuracy, the therapist can shift to helping the client to replace these thoughts with more positive and adaptive thoughts. So again, once you've loosened the mortar with strategy 5, now you're going to rearrange the bricks and identify a more functional way of thinking. So here's some suggestions. The therapist can work collaboratively with the client to develop more adaptive alternative thoughts that are thematically related to the dysfunctional thoughts. In order to choose replacement thoughts, it may be helpful to identify advantages and disadvantages of maintaining the current beliefs. You can do a role play that act out the more adaptive thoughts. And you can also use others as a reference points. For example, people are often more kind and supportive and balanced when viewing other people. So you can use others as a reference point by saying, what would you tell a friend in the same situation? So let's look at and so the predicted consequence, the expected consequence of modifying beliefs is that once dysfunctional thoughts are replaced with more adaptive ideas, it is believed that there will be less emotional distress and more effective actions. So let's look at an example. Same client and counselor. The client says, I just keep thinking people won't like me because I'm gay, and there's nothing I can do about it. It makes me too afraid to try. And the counselor here says, I wonder if you could change that thought to something like, some people will reject me because of my sexual orientation, and some will not. So it's difficult to kind of summarize these strategies into one set of dialogue. Obviously, it would be more ideal for the counselor to help the client come to that conclusion by themselves. So even in this example, this is more likely a summary. So with the idea that people won't like me or people will reject me because I'm gay, during the using strategy 5 of experimenting, presumably the counselor said, who has rejected you? Have there been people that haven't rejected you? How do you know that? And so using that collaborative empiricism, there may be already some lessening of the strength of the people won't like me because I'm gay. And then this replacement thought, this modified belief, this more functional cognition will be the conclusion of a significant chunk of work. So, but we want to help the client get to the idea where they might be able to modify the belief. Some people will reject me because of my sexual orientation, and some will not. So again, this is the conclusion. This is a conclusion that's a little misleading because this is going to be the result of a bigger chunk of work. And when we do the demonstration for this, you'll see that it's not just a single intervention. This is a line of questioning. This is the conclusion to a bigger chunk of work. So let's move on to the next strategy, reinforcing functional thoughts. So reinforcing functional thoughts and putting those beliefs into practice. Once we've modified beliefs using strategy 6, we want to reinforce them. So the theoretical context is this. The goal in cognitive therapy is to facilitate the remission of the patient's disorder and to teach the patient to be her own therapist. She can resolve difficulties before they become major problems, and she reduces the possibility of relapse, and she can use her skills to enrich life in a variety of contexts. So for this one, the graphic, this one's graphic is a little hard to see, but those are the two, there's a little white figure we've seen. These are the two hands. They're holding some dirt, and there's a little green sprout growing that. So we're nurturing the growth of more functional thinking. So when should we use this? Well, in order for new adaptive ways of thinking to be strengthened, they must be reinforced. The therapist initially serves as a powerful reinforcer and gradually teaches the client to reinforce more adaptive thinking on her own outside of sessions. So here's some suggestions. The therapist may reinforce adaptive thinking when it arises in session in the form of verbal acknowledgement and praise, with the goal of increasing this type of thinking in the future and fostering the client's ability to perform the reinforcing functions of the therapist for herself. It may also be helpful for clients to, number one, identify real-world situations in which more adaptive ideas can be tried out and reinforced. And number two, identify supportive people with whom the client can share and discuss changes in her thinking. So with the example that we've been working with a client who is worried about social rejection because of their sexual orientation, the counselor can identify real world situations in which they're less likely to be rejected. So if in this example, the counselor might talk about which of your potential friends are least likely to reject you, which friends have talked about positive attitudes about gay people. And so those are examples that where you're reinforcing functional thoughts in real world situations, but that those experiments are carefully designed. So the consequence of reinforcing functional thoughts is that through repeated reinforcement of new thought patterns in therapy and in the outside world, adaptive thinking becomes strengthened and internalized, while old maladaptive thoughts fade in strength and intensity. And here's the example. My friends asked me to go out last weekend, and I practiced telling myself that it was okay to go out with them because they don't judge me. I repeated to myself that it doesn't matter what other people think. It helped. I wasn't as anxious and I had a good time. Counselor says, that's great. So when you worked with your fearful thoughts and reminded yourself that you have friends who care about you and aren't judgmental, you became less paralyzed by anxiety. Now, the more you practice this, the easier it will become. So we've got two types of reinforcement there. First of all, the counselor helped the client pick a real world example where they were unlikely to be rejected and more likely to be supportive by going out with supportive friends who aren't judgmental. So that provides some real world reinforcement. And then here, the counselor is providing reinforcement verbally in session. That's great. And then encouraging more practice. So the final strategy in this set is assessing cognitive change and impact. And before we move on to this, I just want to make the point that I made about 6, 7, and 8. That 6, 7, and 8 are kind of the meat of the change process and may occur over several sessions. So it's not one and done. Particularly the first 3 in this set, experimenting with thoughts, modifying beliefs, and reinforcing functional thoughts, are the ongoing process of therapy and that may occur for many sessions. So this last strategy, assessing cognitive change and impact, allows you to look at multidimensional impact and consider a shift in focus. So the marker here is after significant cognitive work has been undertaken, it may be important to measure the impact of change on emotional, cognitive, and behavioral functioning, thereby determining whether further therapy is indicated and whether this work should focus on thoughts, actions, or feelings. So the graphic there at the bottom is our little white humanoid figure looking at 3 different doors. So the 3 different doors represent 3 different types of exploration and change. So we've been focusing on cognitive change, but the other possibilities are emotional exploration and change and behavioral exploration and change, which will be the next few lessons. So this strategy, the way we're presenting it, has a little bit indicates the idea is based on the idea of sequential treatment, where we may have focus on cognitive change for a few sessions and then move on to emotional change or behavioral change. But really, it's more with practice, you're more likely to be able to work interactively. So again, our figure says, should we do cognitive change, emotional change, or behavioral change in a sequential manner? But really, with practice, you can work interactively and you can be promoting cognitive change, emotional change, and behavioral change together. But assuming a sequential model, this strategy looks at the cognitive change and decides whether to shift a focus. So when therapists feel that a client has accomplished significant cognitive change, or that a client is stuck and unable to make further progress by focusing on thoughts, it may be helpful to shift focus to emotions or actions by discussing the potential benefits of shifting focus and beginning to utilize experiential or behavioral strategies. So again, this can happen. This can happen in two different ways. One is when you've made a lot of cognitive change and you're ready to move on, or because the client is stuck and they haven't been able to change their cognitions. So, for example, some cognitions are very embedded in a family system, and so it may be important to look at the family system and where did these cognitions come from, and why they were reinforced so strongly in the family. And so again, when we're assessing cognitive change, sometimes there will have been a lot of cognitive change and we need to move on, or maybe there's been minimal cognitive change and we need to work on a different type of exploration and change. So it's predicted that clients who have undertaken several sessions targeting cognitions and are not ready for termination may benefit from additional work focusing on emotions or actions. So the choice between these three doors of cognition, emotion, or actions is a part of the model that we presented in lesson one. But I just alluded to where did these cognitions come from, which is a systemic focus. And so these three foci on cognition, emotion, or actions is part of the picture, but there are these contextual factors we could explore as well. But that's for a broader training model. Key strategies training is an introduction to a broader training model called training in unified psychotherapy. So here's the example. The client says, I feel like working on changing my thoughts has really helped me be less anxious around people, but I know I'm still holding on to a lot of pain from being bullied in high school that hasn't changed much. So the counselor says, I think it might be helpful for us to shift to focusing more intentionally on the feelings associated with those times. That might be helpful in freeing you even more from the anxiety you still feel around people. So there's two different changes in focus here that are implied in this example. So one is the change in working on thoughts to changing working on feelings, working on emotions. But the other change is working on the present versus working on the past. And usually when you're in psychotherapy, when you're working, you're going to be working both ways. You're going to be working from the present with an understanding of where that came from, and you're going to be working on the past with an understanding of how it impacts the present. So the shift in focus here is both, that is implied by this brief example, is both a shift in focus from cognition to emotion, but also from present to past. So those are all choices that you have as a psychotherapist. So that's the last slide in this lesson 3 on changing cognitions. The next video that will be available will be a demonstration of these cognitive change strategies. So I hope you can watch the video next.